Thank you everyone for joining us today. So we're really pleased to be welcoming you to the session, Measuring Financial Stress as a Psychosocial Risk for Workplaces, where we will be taking a deeper dive today into this discussion, and we'll be reflecting on the following. If we already recognize stress, burnout, and mental health as workplace risk, is it time employers started measuring financial stress more proactively as well? This event is part of the ongoing Financial Wellbeing Month campaign created by the teams at Finwell, Mental Health First Aid England, and the Ripple Suicide Prevention Charity. In today's esteemed panel, we have the expertise to begin really unpacking this exact question. So I'd like to kick off by introducing Peter Kelly, founder of Being Real Workplace Mental Health Solutions, and also an advisor on ISO 45003. He was a key player in leading the discussions on psychosocial risk and the work that you see from the Health and Safety Executive today on ISO 45003. Andrew Russell Day, Senior Health and Safety Manager at GES International, Amazon. Great to have you with us from an employer perspective as well. Ryan Briggs, Financial Wellbeing Advocate, through his tremendous work at Finwell, Financial Education. Jenny Armstrong, founder of Construction Health and Wellbeing. Jenny's work really focuses on supporting the construction industry reduce risk caused by workforce health. Elizabeth Bashrad, an associate at Business for Health, really focused on population health with a strong emphasis on the interactions between our health and social behaviors. And then lastly, myself, Nur Shagan, I work as a comms and engagement manager at PFAS, in which I have the remit of well-being and social value attached to it as well. So we're really going to be diving into some questions for our panelists. And I'm going to kick off here with Peter in the first instance. So Peter, please could you spend just a couple of minutes, just how do you define what psychosocial risk actually is, and why is it so important, especially for employers?
Yeah, forgive me for being just on audio, but I was on a delayed train. Psychosocial risk, it's a great question, isn't it? We only spent 3 months discussing it when we developed ISO 45003. But essentially, it's psychological and social factors in work and how they impact decision-making process. So if you have high demands, then there's a probability that that's going to impact your psychological well-being. If you're not supported during it, that will also help impact you. So that's the social element of it, and amongst other things. So those relationships at work, effectively, and how they interact with factors. Now, when we were doing inspection, they closely align with human factors. You're looking at the reasons why people make decisions, and why those decisions lead to outcomes such as, where a safety incident has occurred, and the same for health issues. And so health issues. So it's looking at the workplace and seeing that the workplace doesn't just operate in isolation. It's actually influenced by factors in and outside of work. So that's probably less than 2 minutes, but if I go on any more, I think it just becomes a little bit more complicated.
No, that's fine. And really leading off, I guess, the understanding, like defining psychosocial risk is, how significant do you believe financial stress has become as a workplace psychosocial risk factor? And do employers currently underestimate its impact on safety, mental health, productivity, performance? So really that link between financial stress and workplace psychosocial risk.
Yeah, I think if you look back at the data and the various information that's been recorded over, every time there's a cost of living crisis, it's the new name for a recession or other elements that come in, we do see an increase in people's mental health being impacted. Now, you might say, well, you'd expect that. But the issue is that we don't measure it, and we're not actually putting things in place, say, to protect people when those situations come along. And that's where, as the work has can help and can assist by, waiting, not just waiting for people to be in crisis with their finances, but actually to do something preemptively. So, sorry, that is a big crane. um, what's the chances of that happening? Is the steam train just going past? I do apologise. Um, and it is a factor that you do give consideration, but it's often thought at the well, we can't do anything about it. But that the reality is you can do something about it, and you need to give that consideration. If you're putting people under financial strain when they're coming to work, if they're struggling with the finances, then they can be detached. They can feel that actually they're focusing on what the financial problem is and what should I do about it. A really good illustration of this was a friend of mine is a crane operator. He was a rigger, and there's a guy who's working with him his job was to lock a chain around a pile of 2.5 tons of metal and to lift those in the air. And he has a gentleman that was working on the bottom who's rigging it all up to make it safe. And he noticed he wasn't concentrating. He was actually just not really in the zone. So he got out of the crane and he went and said, "What's going on?" And he said, "Oh, I need to sell my car because I need to find accommodation for my flat because my wife's pregnant." Sorry, his girlfriend was pregnant. And that was just an illustration of how those pressures, those things that are happening financially, impacted on the physical safety of that situation. Now, his response to that was, "Well, let's go and have a coffee." Sat down and he said, "Look, I'll give you £500 to pay for your deposit for your accommodation. Just pay me back when you need to." And I think it just shows, like, had he not intervened, you could have had an accident there on the site because the person's mind wasn't in the zone. And thankfully, the crane operator was able to see that.
No, good example. Thank you for that. Coming to you, Andy, perhaps many organizations measure engagement and well-being, but very few directly measure financial stress. What are your thoughts on that, and how important do you think that is, that we should be considering financial stress?
Yeah, so sure. So, firstly, just on the first part of that question, I mean, I know a lot of companies do measure well-being generally, but I'm not so sure that it's actually been done particularly well or effectively. I think, quite often companies can prevent the statistics from those results if they present them at all, using the responses to reflect the answers that they want to see. So people that may fall into the sort of lower part of saying they're fine and, quite often get pushed into the green part of the KPI and just the very bottom look into the red. So it looks very positive. And, that's done with KPIs generally. I think there's, for most employees, it feels like a stat collecting exercise because nothing's done with it. So, it's really important that when we carry out these sort of surveys that we have some kind of plan, to act on the results that we get. Otherwise, I'm just telling you today I'm not feeling so great. Why am I telling you this? Nothing's going to change, and I think the employer has some liability towards that. But moving on to the second part of the question, and I've said this before when I've spoken for Ryan at at Financial Wellbeing Month. It's a tightrope for employees to talk to their staff about financial well-being. So I don't know if you can hear the rain. It's just started chucking it down here now as well, and it's really quite distracting. Yeah, so if you're going to talk to your employees about financial well-being, most people don't understand the difference between kind of financial well-being and financial independence. And we all dream of financial independence, that moment where we all have the money and we're not worrying about the bills, we can afford the house, we don't have to worry. They don't really understand that financial well-being isn't necessarily about how much you're being paid. It's what you're doing with that money. So whether you've decided to stretch yourself on the mortgage because you really fancied that slightly nicer house. So it's, so when employees ask or think about asking their staff about financial well-being, they're frightened that those people are going to come back and just simply say, well, pay us more. That's what we need. Particularly if you have a high proportion of your workforce is maybe low paid and claiming in work benefits. It's a difficult topic to address. And we still have the stigma around money, right? I mean, there's huge stigma around talking about mental health. There's an even bigger stigma about talking about money, and particularly, um, when maybe you don't quite have enough or you are struggling financially. So I think it's a really difficult topic for employees to discuss. And like I say, unless there is some sort of plan, some sort of follow up for those people that are saying I've got issues, it's pointless even asking the question, right? So, employees need to look more at, what services they can provide, what services they can, bring in from other organizations. Maybe if the companies have an employee assistance program, is there anything the EAP can provide, that the employees can, go into and find some help and support. I know at Amazon, we're starting to launch a lot of financial well-being products internally to help people with debt, with mortgages. We have the counselling services available that people can talk to generally. So, I think unless companies have a plan in place, there's really not a lot of point in asking, the question in the first place.
Okay. Thank you for that. I think good reflections, especially taking some examples from Amazon. Ryan, I'm going to come to you here, and just what do you think that gap? Why do you think that gap still exists, and what are the risks of ignoring it, especially during the times now?
Yeah, I think we're on a bit of a journey with this, and we've spoken about this for the last 5 years, Naz, haven't we? The similarities that we see, we've been we're in our 5th year now. We've experienced a lot of feedback from employers and seen them kind of go on this journey with financial well-being. It's really great. Can I just say that I think we're now talking about and using words like risk and measuring and impact. I think we're moving away a little bit from just the financial well-being language and terminology to one that organizations can understand a lot more. But the gap exists, I think. As I say, that journey that we're on is so similar to what we probably remember and have experienced with mental health support, right? The fact that it's awareness to start with, and certain pockets recognize it and recognize the need for it. There's an element of it being a trend, within workplaces, and that's part of the journey. Then comes more awareness and more education, on top, that this is something that they really need to consider. That maybe then helps to back up the moral case that this is something that organizations should be doing, which is absolutely fantastic. Then we saw what came in was a bit of kind of resistance from employers. I think Andy mentioned it a bit there. The responsibilities, they're actually even a responsibility for employers to do anything. Maybe not. It's they've got a responsibility to pay fairly and to pay pensions and other things with legislation. But we're now kind of seeing some organisations being a bit more advanced and really looking a bit deeper and looking at the commercial impact. I think this is really what changes things and moves the needle. Certain organisations realise that this is a risk to the business that has a commercial risk, and something needs to be done about it. And it's only now at this point that we're starting to work out ways of measuring all of this stuff, for individuals, for employees to measure where they're at with their own financial well-being, what they need to focus on, for employers to measure where they're at as a business as well, what they need to do. It's quite encouraging that most of the organizations we speak to now know they want to do something, know they should, know that it will impact their business, but they don't know how and they don't know what to do. And for us, that's why we came up with this way to maybe measure financial well-being and stress and pressures, or at least try to start doing that, because there's a need for it. There's a need for it. And I will talk about that in a bit. But we're really encouraged now to see that these discussions are happening, especially within certain sectors. Andy and Jenny, from construction, we're seeing it in engineering, manufacturing, transport, some of perhaps the higher risk sectors. And we're also seeing, and I think this is really, really important just to finish on, the massive need to not discount any area of support, because if we look at EAPs and some of the support that's out there for more reactive solutions and crisis-based solutions, so vitally important. What we're trying to do and fill a space in is more the preventative and proactive side. And I think you absolutely need both. You're going to have people at different scenarios and they need different types of support.
Thank you for that. I'm going to come towards Jenny now, because I'm quite interested in terms of looking at the construction industry. And why is this specifically important in the construction industry, where stress can not only impact productivity, etc., but it can actually be quite life-threatening?
Yeah, I mean, I think Peter's introduction, where he shared the story about his friend that was a crane operator, is a really good one that highlights the impact of someone's mind not being on the job. And I think all of us probably can relate to the same experience as what that can be like. But obviously in the construction industry, where it's high risk, the consequences of that could be fatal. I suppose the other bits to try and build on perhaps some things that Ryan had just said and Peter's earlier story is, as a construction industry, we're actually a big contributor to a lot of these financial pressures that our workers experience. We don't employ people in the same way. There's often short-term contracts, or people are given the next week they're moved from another job, or they're taken off another job. So that financial security is fundamentally, has additional pressure because of the nature of the construction industry. And equally don't have enough access to the right support for the right people. Those in the big tier one organisations, probably feel very different to those smaller organisations. And our industry is made up of those small organisations. So yes, it's a productivity thing. We are very program driven because that's what we get paid for, and that's the essential part of what construction projects are. Yes, we know there's a safety risk. We know we have a huge mental health crisis already, and this is just now compounded and acting on to additional pressures that our workers are experiencing. But I think there's more of a need as an industry that they need to take more action because of those other fundamentals that affect people's finances of the people that work within our industry.
Brilliant. Thank you so much. I'm going to come back to you, Andy, just to try and consider kind of what are some of the signs, or what signs or behaviors are leaders, managers, wellbeing teams, HR most likely to notice when employees are struggling financially, and how can organizations respond earlier, being more preventative, being more proactive rather than being that reactive?
Yeah, so it's a difficult one to hone into, when somebody is suffering from, something very particular within the sort of that's affecting their mental health, because I guess many of the indicators are going to be typical of mental health generally. So behavioral changes, personal presentation, absenteeism, etc. It's they all sit within the same world, but there's some directly relatable ones. To people maybe asking for more overtime, they may be asking for advances on wages. They may be reluctant, particularly in my sector, construction. They may be reluctant to take time off because they don't necessarily get paid when they take time off. So you could find them trying to work 6 or 7 days a week. So it's important to spot those sort of patterns, and I think we've got some technologies in place that allows us to see those sorts of patterns in construction with some of our site access controls. We can look at the hours that people are working, how many days concurrently they're working, etc. So we can make some assumptions from there, but it is a really difficult one. But in fairness, it's about being proactive. We're in a cost of living crisis, right? It's fair to assume that that some, if not many, of the people that are, that are working for you are feeling those pressures, and some of them will be really struggling with those pressures. It's not just going to be a case of they can't get a Costa coffee every day, but they're generally struggling to pay their bills. So I think there's definitely an element of responsibility from the employer to proactively, consider what is likely to be going on with their workforce, and like I said earlier, to start thinking about what they can put in place to support. Socializing these topics is a really important one. Again, in construction, we have the opportunity to have sort of toolbox talks and stuff like that. So we can bring these topics up directly to our people, face to face, but en masse. So we're not sort of singling everyone out. And the more we socialize the topics, the more we get them speaking on it, the more you'll hear them talking about it in the canteens. And, the more people are likely to, then come forward when they do have problems and seek help. I don't think we can always hold their hand through the whole process, but we can certainly allow them to identify the issue and then signpost them to that support, and then ourselves support them as they go through whatever it is they need to go to get results. So yeah, I think it's about being on the front foot, and like I said earlier, having those resources or those plans in place to support the people. But it is a very complex issue within construction specifically.
No, great. Thank you for those and the reminders. I know previously when I looked at financial well-being, I remember the time that we used to monitor, when we were more, on site and able. You'd see people's eating habits. Sometimes people were skipping meals, or, we were lucky enough in my previous role in that year, we had access to a canteen, and you would see the volume of people that would take the option that was a free option more and more, or, some sites when they have, drinks machines or soups, etc., they see a high uptake of like, etc., when at certain times of the month. But I expect that we're going to see more and more of that. I think it's to really look at what are the patterns. So thank you for that. Elizabeth, coming to yourself, I think given your focus on population health, how does financial stress intersect with other established health and social drivers, and what unique perspective does this bring to the employer risk discussion?
Yeah, thank you for the question. So first, population health really looks at 4 different areas. A lot of what has been talked about in terms of our health behaviors and lifestyles, the places and communities that we live in and with, so the workplace itself, the health and care system, which we will interact with at some point if we're talking about health and safety, and then the wider drivers. So from that perspective, financial stress, which has been mentioned, is rarely just about money. It's more that amplifier across multiple health and social risks simultaneously. So if we see people that are under persistent financial pressure, we see those impacts across mental health, physical health, cognitive functioning, which we've heard termed brain health, and even long-term work participation. So, and it mentioned briefly, but the stress affects sleep, increases anxiety, depression, reduces concentration, decision-making, and it can make it harder for people to engage in these healthy behaviors. And we know that these don't stay at home when people come to work. So I think when employees are experiencing this financial stress, and Andy mentioned presenteeism, burnout, distraction, and safety risks, especially in construction. So from an employer perspective, this is not a personal issue. It becomes organizational performance and workforce sustainability issue. And I think what's also important from a population health lens is that financial stress is not distributed equally. It disproportionately affects people already facing other vulnerabilities, younger workers, carers, people with long-term health conditions, lower income workers, and we mentioned high cost of living. So these compound existing inequalities and create what we sometimes call a negative health cascade. Someone under financial strain may delay healthcare appointments, skip medication, reduce healthy food spending, socially isolation, and disengage from these preventative health behaviors that we're asking employers to do. And this really affects both health outcomes and workforce participation. So I think one of the shifts that has been mentioned and we're really starting to see and hoping gets amplified as well is that we view it through the same lens as other psychosocial risks. And we already recognize that this chronic workplace stress can negatively affect these outcomes. So financial stress operates in a similar way. It influences our emotional resilience, our bandwidth cognitively and physically, and ultimately performance. So in this current economic climate, I think employers who ignore this risk are likely underestimating both the human and organizational impact. And to Ross's point or question in the chat, this came up in a conversation yesterday around legal requirements, and the Employer Rights Bill has some language in there that extends this duty of care. Yesterday at a Future of Work conference, I saw the AI impacts and avoiding regulation. The UK is just avoiding it. And what is happening in other countries is that companies are being fined. And so it would be an interesting scenario in which, if we have a legal obligation for this duty of care, what happens to employers if they don't attest to this?
Yeah, fascinating, and thank you for walking us through that from that lens. And it's interesting to see how this actually unpacks. I think the legislature will move towards that. So I am conscious there are questions in the chat, so please bear with us, and I will go back to those as soon as we are able to. If I could please ask, if you aren't speaking, to please put yourself on mute. Jenny, I'm going to come back to yourself and ask the question, I guess, around why is this topic from a construction client's point of view, why is it so important, and how can we give our audience, for example, how can they be encouraging supply chains to embrace this approach to measuring financial stress as a risk factor?
There's a couple of ways to answer that. I mean, I think in the construction industry, everything is contract driven. So if you have a project and you have appointed your supply chain of organizations to deliver, if things like this are put into that contract, it gives you the mechanism to allow things to be done. I think even in the world of health and safety, we can say, oh, you must comply with the law and expect things to happen. But until things are fundamentally put into contracts, that is a huge driver within the industry that we work within. I think from an employer's perspective, they are tendering for work and they have to compete with each other. So that company that might do all these amazing things for their employees and give lots of access to support, are going to be compared with an organisation who doesn't do any of that stuff. And at a client's perspective, at the moment, the construction industry will be probably cost driven. Some of the projects are a little bit more mature and we'll see things differently, but it would be a cost driven approach, and that company will probably be costing more than that company. So they will go for the cheapest. So I do think from a client's perspective, there's so much more responsibility they do have about setting out their expectations and what do they actually mean. We can say things like, oh, yes, we want you to have a wellbeing program, but we know that could be a couple of posters on the toilet doors versus a really engaged, opportunity for people to speak to professionals, and enable that side of it to actually happen. I think the other thing that's probably is really important with construction, and this is actually something that we've experienced with Finwell ourselves, is principal contractors and clients, often have to bring things to the workforce. A lot of these companies that have people that move around sites all the time, they haven't got the luxury of a Teams call where they can dial into a webinar or have access to taking half a day off to go and speak to someone to get some financial advice. So we need to bring things to people in the most accessible way. And principal contractors and clients, I think, have a responsibility to do that. If you truly believe in what we're talking about, that this has a benefit on productivity and performance, then actually, yes, you need to almost put your money where your mouth is and make sure that you are enabling those things to happen. Because if it comes to the smaller contractors, they're not going to have the time or the resources to set this up in the most appropriate way. And they might, ask a few questions, but they probably won't do it in a way that's going to give them meaningful data. They need to be handheld to do that. And it's probably the most cost-effective way of doing it if principal contractors take a bit of ownership, because otherwise you just having all these services cross-charged back to you and the bills just getting higher and higher without actually any impact and effectiveness that's being measured. So yeah, but bringing things to those organisations is the priority, I think.
Yeah. No, interesting and fascinating, because I definitely see that element of bringing it into the contract from a social value perspective. So that's a whole other webinar in itself, but I definitely see that link and how it ties into social value. Elizabeth, I'm going to come back to you to add to this as well, is in terms of how can employers link financial well-being offers to outcomes, and thereby fostering a culture where health behaviors, including financial ones, are seen as intrinsically linked to overall well-being.
So in your question is part of the answer that we want to avoid these one-off initiatives and embed them into the broader organizational health strategy. And I think when we have these options like financial education, EAP, savings schemes, or debt advice support, we need to measure whether those interventions are actually influencing workforce outcome in meaningful ways. So the question really becomes, what are we trying to improve? We know that financial well-being matters, so we should start seeing connections with outcomes like absenteeism, presenteeism, retention, burnout, engagement, obviously safety, and even workforce participation over time. And I think what's really interesting from behavioral science is that chronic financial stress creates cognitive overload. And so when people are worried about paying bills or managing debt, it consumes their mental bandwidth. And that makes it harder for people to plan ahead, make healthy decisions, engage positively at work, or even access support. So what we're trying to make the link is that we're not seeing it separate from other health behaviors. It actually directly shapes them. So that also brings us back to culture. We mentioned stigma, shame around financial difficulty. So these remain invisible until they escalate into crisis. And if we start openly recognizing these as legitimate well-being issues alongside mental health and physical health, then that fosters that psychological safety. And that signals that these conversations are acceptable and people can seek support earlier rather than later. So if we want to link those measurements to outcomes, we want to look at leadership quality, job design, workload, flexibility, and it's never produced by one intervention alone. So when organizations choose to measure these things, what it often reflects is that what they value culturally. And if they measure financial stress alongside other psychosocial risks, for example, it helps legitimize the issue and drives more preventative approaches. So ultimately, this is really about keeping it interconnected in the same parts of the system, and not just an ethical issue, not just a moral issue, not just a legal issue, but a strategic issue tied to the resilience, productivity, and long-term organizational performance.
Thank you. Peter, just going over to yourself, I think, in terms of if employers begin treating financial stress in the same way as other workplace risk factors, what long-term outcomes or cultural changes could that create for employees, leadership teams, and wider business performance?
I had this conversation with Ryan when we first had this meeting. I think it's financial pressure that businesses are under financial pressure. The financial stress element is the response to the pressure that's there. So I think in a language perspective, if we're looking at pressure and we're looking at demands and looking at those characteristics, it's easier for employers to think, okay, yes, there is financial pressure. What can we do to relieve that pressure? And which will lead to people feeling financial stress. So I just think maybe there is something about the language that's important for him to get this across to employees, to employers as well. So, but what you will see if you begin to manage the whole view of well-being, so not simply EAPs or interventions which are done at the support level, if you start to do something within businesses and you prioritize this as you prioritize other things in the business, I think people will feel that the employer is engaged and is understanding of their situation, and they're more likely to work effectively and feel more in control. And I think that's the key thing here. Financial pressure makes you feel out of control. that when when you feel that out of controlness, that will lead to errors of judgment and also impact you. But it will also lead to this physical sensation of stress, which is the anxious feelings and that. So I think doing something to support people when you are aware is really important. So if a conversation is had whether someone says, I'm under finance, going back to the example I used, the simple intervention there was to help him for a short period of time over a financial crisis. And I know that's not possible in most scenarios, but I think it's just being creative in what those things are. You know what I mean? And businesses need to say, if we really care about people, then we will care about the whole person, which means we will do things in a financial crisis to support our employees to get through that. So, for example, with the increase in fuel and gas and electricity, some employers were in a position to offer advances to their employees to cover the financial burden that they were in. So there's no real quick answer. Sorry.
No, I think it is something that's in progress. I think the main thing is that I think the education piece, as you mentioned before, and many of the panelists have, is where I think the starting point is to really ensure that we bring about that cultural change. What is our responsibility and what is their responsibility?
I want the educational piece to have consequences. It's not simply about educating. It has to be organized. How is the organization going to be involved in the response to the education? Are we going to educate people but give them nothing to support? That's a contradiction. That's where it will, in many well-being scenarios, the perception is, why are we doing this? Because this actually the real issues are these sometimes. And not, I've come across giving people pizza at 11 o'clock for when their lunch is at 1 o'clock is not, as an intervention, going to support people's well-being. The same on financial. If we need to put systems in place to support people when financial issues arise, and particularly when we know it's coming. Look, the cost of fuel, gas, electricity, and flights, all of that's going up. In the next 6 to 12 months, we're going to see a rocky road in the financials. So what are we doing now to support people?
Yeah. Thank you for that. And then I guess bringing this all together, and I'm really also conscious of our time and being able to go to the audience questions as well. I guess bringing back to you, Ryan, to tell us a little bit more about the new financial stress risk assessment and how it can be used within the workplace.
Yeah, sure. There's a lot of challenges, right? This is a big area. The first thing I'd say is we've tried to create something to start the conversation. This is not a silver bullet. This is not a solution to all the problems out there. Everything that we've kind of tried to do at Finwell is in response to what employers that we're working with have asked us to do. And that's been the case from when we started, like I say, four years ago or so. So again, I think it's important. Some organizations are just not going to be ready to measure this. Andy said it, unless you're willing to look at some options or look at interventions or solutions to try and support, you might not be ready. But some of our organizations that we work with are, and I think we're doing a lot of work now with professionals in occupational health, a lot of people that are measuring data in a great way, and the extent really is looking at absence or looking at incidents and then trying to delve a bit deeper into, well, what was the driver of that, or what was the cause of that, and then they can report back if it was related to money or financial well-being. What we're trying to do is take it many steps before that and look at prevention and being more proactive, really. So we're very much looking at ways of engaging with employees, with people on a construction project, however they might be employed, and try and measure this stuff. And it's definitely not easy. But we wanted to come up with some questions that could try and move the dial forward. And we looked back at some great work that had been done by some of you might know the Money in Pension Service. MAPS is a government organisation in the UK, and they came up with in 2022 a list of 9 questions actually to really try and measure financial well-being for individuals, for employees. So we took that and looked at the questions, added some of our own kind of experience of what we had learned, and came up with 10 questions as an initial survey for employers to be able to share with their teams, to start to really measure financial pressure, as Peter mentioned. And I must say that we're very collaborative with all of this. We're not going to have got it all completely right. This is why we want to open it up and invite organizations to work with us on it to continually improve it. But look at measuring financial pressures and the link and impact that might have on stress, and how that can be scored in some way. So to give you a bit of an update, we have done the first case study. Happy to share the information on that. It is only the first one. It was really important, I think, like all surveys, for this to be as short as possible and as simple as possible. The feedback that we was told, it needs to be anonymous, completely anonymous, so people could share their honest feedback. Some of the interesting feedback we had when we was trialing it was that it needed to be quantitative and qualitative. So it's not just the answers. There's some free text in there that we added that was quite insightful for this first case study as well, that we can pass that information back to the employer. And yeah, the outcomes for the first case study, like I say, we'll share it on a link afterwards, and we'll make that available. But it was quite positive in the fact that there was no one in the high risk category on this particular case study. There was a few, I think it's about 19% that were close to the high risk, but no one that was actually in that category based on the questions that we had put in place. Around 90% was in the moderate risk area, the moderate risk zone. And there was about 20% that was, about 10% that was in the low risk zone. So it was a good outcome. It was only a snapshot. And the idea being that we can start to look at, well, what interventions, what measures could be put in place dependent on what the outcomes are from that. I think it's really important that you need to look at, well, what is the demographic of the people that have completed it, and what roles are they in, and what is the risk factor possibly of their work as well. But it's definitely just a starting point. But that's now available. Anyone can take a look at more information. I think the link is there on the page, the finwell.training/risk. And it's just an invitation to any employer that wants to continue this conversation. It's completely free. We're not looking to charge for this. We really just want to work with employers to understand how we can make it even more credible, even more effective, and even more impactful, really.
Great. Thank you so much, Ryan, for sharing that. I'm going to go to a bit of the chat and let's see what we have there. So first of all, from Ross, I think there has been some conversation around this in the chat nonetheless, but I'll bring it up because I think it's quite an important one. So Andy mentioned asking but not doing anything about it. The question is there any legal implications of formally measuring the cause finances in a business, then the business not acting, doing anything about it? I think, Ryan, you've kind of responded to say, I think there is by the Health and Safety Executive around general stress, but it is a bit of a grey area at the moment with any specifics to financial pressure. I can second that. I think in much of the work that we've done around looking at stress risk assessments and understanding the Health and Safety Executive's direction, but I think many of the panelists have alluded to it. I think is if you look at some of the legislature, it might not be there directly implicated where it talks about financial well-being or financial stress. We have a duty of care, and in terms of that, when and if it does occur that an incident is associated under investigation, I would assume that all of that would would be looked into. And especially this point of, if you knew, what did you do about it, tends to come up, in my experience, at least in some of the cases that have come up. I don't know whether anyone here would like to chip in or chime in. Elizabeth, you said EU has stricter guidelines. I think
I was just going to add to that.
Yeah.
That Ryan mentioned working with occupational health, and in other countries in the EU, occupational health is mandatory. It's a requirement for employers to have, not an add-on. So in that respect, there are some legal obligations to it. I think where it gets a little murky and a little gray is that we all mentioned it doesn't exist in isolation. So whereas that, and someone else said it, I think Mike, you said it, is it cause or effect? And so I think, unfortunately, the UK has to revert back to the duty of care guidelines, Employer Rights Act, and sometimes that gets a little tricky legally. But I think from ethical, moral, and reputational aspect,
Yes.
it definitely has impacts.
Yeah, definitely.
I think in my experience, it will be wrapped up with other issues, and the finances are one element. So the financial crisis, where we obviously, if you think about the financial crisis, we have seen an increase in suicide in certain sectors. So at that point, that's predictable, but that also might be a consequence of the financial crisis, because there's a global recession on, and that impacts people. I haven't directly come across a case where it's just solely that in isolation. In most cases, it's a combination of factors that lead to an employer seeking to, or leads to families of an employer to seek compensation. I think but if you do a well-being survey and you ask about people's financial security in there, and you don't, and then people say they're struggling with their financial security, there is a duty to do something with that.
Yeah.
It wouldn't necessarily fit under the Health and Safety at Work Act, but you could form a linkage, and this is where the courts determine much of this. The court could determine that there was a duty to do something with that information. So, yeah.
Yeah. Yes, Andy, you've got your hand up.
Yeah, so just want to add and talk about the grey area that exists in some of this. So yes, the HSE requires all employees to have a stress risk assessment for their employers, but it typically only needs to focus on the stresses of the job, so not external stresses that people might encounter from financial well-being and family breakups or whatever. So that doesn't really go far enough to help protect, but then they also do have a duty of care. And as Elizabeth said, in regards to occupational health, there is a duty of care once they're aware that their employee has a problem. But again, it all comes under the banner of reasonably practicable, and all they're really ever going to do is treat the symptoms and not the cause. And this is the problem. So the cause all the way through that process doesn't get resolved or sorted. And we are very, very good at putting in lots of resource for when people get to crisis point. What we really need to start doing is getting much better at stopping people from going on that journey to crisis in the first place. Start further downstream and support people, because there's huge benefits to be had from it. And again, coming back to something Elizabeth said earlier, and my industry, construction, where mental health statistics are pretty terrible. Somebody coming to work on one of my sites who is suffering from serious stress, depression, anxiety, whatever the cause of it be. It can be the same as them coming back to work after having 3 pints at lunch, right? And having the same sort of reaction times, the same sort of critical thinking of a person that's intoxicated. And we don't want that on our sites. 22% of incidents, a recent study shown 22% of incidents on sites the root cause is mental health. Is because they're not present. They're not. That's over a fifth. Almost a quarter of all our accidents on site, and some of those will be serious and fatal accidents as well.
Yeah.
So we really need to start tackling the issue further downstream and not preventing people from coming to work stressed in the first place. We need to support them so that they can do their job properly. And there's benefits to be had from quality, from reduction of incidents, from project delays, etc., absence. There's huge value from it, just from a business perspective. So if you don't care about the people that work for you on a personal level, there are still huge benefits to come just from doing the right thing, for your business.
No, excellent points made. Thank you so much. Mike, I'm going to go to you in terms of, you said going back to Ross's question, so it's all about this legal element. Is there not the same sort of calculation as there was in the Thriving at Work and subsequent reports for general workplace mental health? That's a tricky one. From my readings, etc., I wouldn't say there's an actual calculation that I'm aware of. Ryan, I'm going to put you on the spot here in terms of that one, and please do, if the rest of our panelists, if you've seen anything in terms of some sort of calculation.
What was that for, Nuz? Sorry, calculation.
So in relation to, I guess, this, Mike, did you, because we're a smaller group, happy for you to come off mute and be able to elaborate a little bit more around kind of this sort of calculation that you're thinking of?
Yeah, hi. Can you hear me okay?
Yes, we can.
Yeah, so the Thriving at Work report, and Peter Kelly will obviously know a lot about this from HSE background. So the Thriving at Work report was the first major report that looked at the return on investment for mental health interventions. So it sort of 2016 era, if I'm right, maybe even a bit sooner than that. And it looked at various things, and it came up with a figure on average 4.2 times ever for a number of interventions. So it saved the employer £4.20 for every pound they put into a range of mental health interventions. So I just wonder if the same sort of calculation has been done for at least some of the things we've been talking about today.
To answer that, Mike, and maybe Peter can come in as well in a bit, but we've seen that, yes, and I think that's a really good point, because as I mentioned before, with the similarities in the journey we've seen and been on with mental health and support, and the language and the implementation over time is really, really similar. So we've already seen there was some research published and quoted by Benefex around exactly the same, and you can look it up, or I'll share a link. And it was actually the figure given, I think, was £3 in return on investment for every £1 invested in some form of financial wellbeing support. There's also other research we've done personally ourselves that's tried to pinpoint the actual cost of poor financial wellbeing per employee per year for a business. That came out at around £460. I think that's quite a conservative view. And it wasn't taking into account too much of recruitment costs of replacing staff that might actually leave. So we're starting to see that now. We're starting to see the same sorts of messages that are coming out, trying to quantify the actual problem, which is good, I think. I think it's encouraging to see that. How much you read into that, I think there's always a bit of skepticism around, well, how is that calculated and what does it actually mean? You're always going to get that with data and numbers, but I think is a good step, and it's one that I think employers massively need to see if they're going to actually shift to move into more preventative and proactive measures to actually save money on this.
And then on that note, I'm going to hand over to Peter just to get the last bit in, and then I'm going to close off the session. So Peter, over to you.
Yes, so back in 2008 and 9, the Health and Safety Executive approached the Treasury, the actuaries in the Treasury who predict financial outcomes. The response at the time was it's approximately 4 times the salary cost for sickness absence. So when it comes to mental health, so if you take an average If you've got someone off for 3 to 6 months, then you can do the numbers. So it's quite substantial. The well-being numbers, which came out of the Kerry Cooper's Mental Capital and Wellbeing, which was the Foresight report, which predated Carol Black's work, which was 2016. It's actually 2015, Mike. So you got the year right, and that's so. And that's where these numbers sort of came from, about £4 in every pound that you've put in. That was predating apps, which brings me obviously to the next conversation, which is the cost benefit of apps. No one really knows how much people can produce an app and sell it to you for 75p per person, but we don't know how effective they are. And if they're actually doing anything. So I think you need interventions that are robust interventions where you can track and follow the changes in people's behaviour when it comes to well-being, and in terms of also with mental health. We've got to get a lot more savvy in how what the data says and does with regards to but one in three. The £3 model is £4 model seems to hold true, but I think much of that research was done before the AI and the absolute wave of apps that have been given to us, and it's not without respect for looking at them, but relatively small amount of evidence base that they work. And we need to be using evidence base, don't we, Elizabeth?
No, so thank you everyone for attending. I think there's been a fascinating conversation. I think there's a lot of food for thought. Thank you very much to our panelists for their contribution, for the expertise. I know I always go away from these sessions having learnt something more or really piqued my interest in terms of what is the next thing. I will say that Ryan will be able to share some of the resources that were discussed on the call. Ryan, in terms of kind of case study or any of the useful links, etc. So please watch out for those. A recording will be sent out as well. But thank you very much for this really kind of open conversation, and really I'm sure that we will see this develop even further and further. If I think around where mental health was while back and where we are today, even just understanding what is psychosocial risk, where we were a couple of years ago to where we are today, the conversation is definitely moving. I think Jenny, you and I, like as we said at the start, is that we're definitely seeing, it might be slow but progressively moving, that people are opening up the understanding. But once again, a big thank you for you all for making the time, for being here this afternoon, and all the work that you do in your everyday to really push these conversations. So thank you so much. Ryan, over to you if there is any last 1 minute just to add.
I don't think so. Just, thanks everyone. Thanks for the speakers and yourself, Naz, for brilliantly hosting and facilitating as always. But we'll share everything we can. Let's try and keep the conversation going as always. This is the start of it. I think we're moving in great strides, but we're just at the start of it. So thanks everyone, and enjoy your afternoons.
Yes, thank you so much. Have a good rest of the day.
See you later.
See you later. Take care, everyone.
Somebody wasn't on mute. Gotcha.